Hi, this is Randy, founder and Chief Technology Officer of VDI Laboratory. In this video, we're going to take a close look at our Complete Wellness Panel. And the name Complete Wellness is really what we're trying to achieve here. This unique panel of tests for VDI is designed to detect occult disease or deficiencies in the apparently healthy animal. Now within this panel, there are 21 different parameters that we've assembled to cover a wide array of different occult diseases. And I'm going to walk through them briefly. So first what we have is the essential vitamins and minerals. Now, many of your patients, are often insufficient in things like vitamin D and magnesium, which are easy to detect as well as easy to correct through dietary means. And that's part of the Complete Wellness Panel. Next, we're going to take a look at inflammation and chemistries. Now, inflammation in the apparently healthy dog, by definition, is chronic and shouldn't be there. So that detecting it is very important in terms of whether or not the dog is well or harboring some occult disease. And further, when we separate out and look at the chemistries, and we separate those between inflammatory and non-inflammatory, it really helps to assist in determining which kind of diseases may be present. And we're going to walk through that a little bit more later. The next is a VDI exclusive. This is our cancer risk assessment score, where we can detect early stage cancer before clinical signs are even present. And lastly, another VDI exclusive is the ability to detect early stage degenerative joint disease. Now, the list of all the different parameters are on the bottom of your screen, but we're going to walk through all of them. So we begin with the dashboard. Now, the dashboard provides a quick visualization of patient results. When everything's green, everything's great. No reason to go further into the report because it's all within reference intervals. But when something's abnormal, you'll know it right away. It's color-coded. It could be a deficiency. It could be abnormal. It could be some parameters elevated. And we go even further than that, in that we will provide trending for inflammation, cancer risk, and degenerative joint disease from the prior result, so that when you are looking at a follow-up testing on a patient, you're going to be able to see whether something's trending up or trending down. Now, many of you may be familiar with our vitamin D report. We are the only company out there that actually provides patient-specific D3 supplementation. But on our vitamin D report, besides just providing the result, we tell you exactly how many international units you need to dose that particular patient. We also give you the history from prior testing, so that when you're following up on that particular patient, you'll know exactly what the dose was given, what the value is, so that you can correct things as necessary on their annual exams. We do the same thing for magnesium. And we'll tell you it in actual units, in milligrams per deciliter, so that you understand what kinds of dosing is going to be necessary. Now, when we look at our B12 folate report, we'll do the same thing. We'll give you the values. We'll give you dosing for B12. But one thing we do, and to take a little bit further, is that we plot folate versus B12. This is very useful because it can give you insight into certain GI processes. Now, in this particular example, it's the classic where you have a very high folate with a low B12, which is often indicative of small intestinal bacterial overgrowth. So every one of these reports will have this automatically plotted for this particular patient. Now, all of our supplements that are on these reports are things that we provide. We are a distributor for RX Vitamins. We also have our own unique magnesium transdermal product. But we do give it to you in international units and in milligrams, so that if you want to use an alternative product, that's not a problem. Feel free to do so. Now, we have put together this concept called Intelligent Diagnostics. Now, what is this all about? Well, when you're getting a bunch of lab reports, often you just look down the column, you see what's high, what's low, and you're looking at them on an individual basis. But that's not really how things work. It's important to take a look at things, how they relate to one another. It's equally important to find an abnormality as it is in relation to another parameter that might be normal. So what we did is we put together a bunch of white papers as it relates to the parameters that's in the Complete Wellness Panel, and we let machine algorithms, computer algorithms, actually figure out what those combinations and what's the most likely disease that might be prevalent in that particular patient. So here are all the parameters that's involved in it. We've got the Chem 12, everything that's common in a Chem 12. We have our specialty parameters, and we also use age and breed, because these are equally important. And then what we do is we assort, we eliminate things that are not relevant, and then we rank in the most probable disease listing, all right? And so let's take a look at a few of these. Now, this is our differential list. This comes with the complete wellness panel. So when something is green, that means that it is normal. When something is red, that means it's abnormal. So in this particular patient, what we've seen is in this particular combination of abnormals and normals, liver disease happens to fall at the top of the list. Now, if we were to change those parameters, where now we're looking at a non-inflammatory situation, but we still have some elevated chemistries, you can see the list gets very different. In this case, at the top of the list is diabetes. We can change the list again where the cancer risk is elevated, CRP is elevated. We've got certain alk-phos and globulins that are either high or they're low. And you can see then how the list then changes depending upon what the particular abnormalities are. You may also notice something called the CAR ratio. Now, the CAR ratio is the CRP albumin ratio, and it is an important parameter for prognosis. So when you have elevated CARs, that means that the patient is experiencing elevated inflammation and suppressed albumin. When those two things go in together, that means that the patient may be in shock or some other kind of very acute situation that may not necessarily be apparent and requires particular attention. Now let's talk about our cancer screening. Here what we use is unique to VDI is thymidine kinase, which is a DNA proliferation enzyme. This is a marker of dysregulated proliferation. So it's only elevated when you have certain cellular processes, the big one is cancer, where you do not get normal cell division, and hence TK1 is elevated. TK1 is elevated in all cancers, particularly elevated in things like lymphoma. We couple that with CRP. Why? Because cancer is an inflammatory disease, and we're expecting to see inflammation in the patient. And so together what we do is we generate something called the Cancer Risk Assessment, or CRA score. In a big study that we did looking at about 360 dogs, we measured them at time 0 and then followed them for 6 months, and we were able to detect 82% of cancers 6 months in advance. Now, here's the CRA score that was in those patients, and you can see how that stratified the risk of patients in the following 6 months. So those that had a high CRA score had a very high incidence of cancer. And this is very useful in high-risk breeds, older dogs. As we know, cancer, half the dogs over the age of 10 are going to end up succumbing to cancer. That's become quite prevalent. Another VDI exclusive we're really quite excited about is the use of hyaluronic acid. Now, hyaluronic acid obviously is in the synovial fluid, and when everything's fine, you have very low levels of hyaluronic acid in the bloodstream. But when the joint begins to degenerate, HA begins to seep out into the bloodstream, which is where we then detect it. And when you have more severe levels of degenerative joint disease, you're going to get higher levels of hyaluronic acid, and so it becomes elevated in degenerative joint disease. In a study that we looked at, you can see that healthy controls are well below patients with degenerative myopathy or osteoarthritis, making it a very good marker for the early detection of degenerative joint disease. So we've tried to do with a complete wellness panel is put together a comprehensive grouping of parameters that we feel will be exceptionally useful to detect occult disease in the apparently healthy dog. Useful on all breeds, those that are high risk, and especially those that are over the age of 5. Used as part of an annual health prevention program, this can be helpful in keeping your patients healthy and disease-free. We've packaged the parameters exceptionally aggressively to make it an exceptional value for both you and your clients. We thank you for learning more about VDI services.